Well, dual investigations are this morning underway into how a Perth quarantine worker caught COVID-19 after the case sent 2 million West Australians into lockdown. For more on this, I'm joined by infectious disease physician Dr Sanjaya Senanyaki in Canberra. Doctor, thank you so much for your time this morning. It's now been confirmed the security guard has the highly infectious UK strain. Was a hard lockdown the right decision or an overreaction?
Look, Ali, I think it is a reasonable thing to do. There's a precedent. We've seen it with Brisbane, with their recent outbreak with the UK strain. I think the UK strain being more infectious, about 50% more infectious, that's one factor. And also the fact that this individual had been around different areas in Perth for about 5 days, while infectious means that it could have quite a wide spread. So I think it's reasonable to cast a wide net early and look to narrow it as the situation changes.
Yeah, I think a lot of people feel it has been better to be cautious in this one. Are you expecting to see more positive cases over the coming days?
Look, it's interesting. With Brisbane, we thought the UK strain was here and we we're going to see lots of positive cases, but we didn't necessarily do so. And I think part of it is because in the UK where it was occurring, it was an area of very high population density. In London, you've got a cold Northern Hemisphere winter, and they weren't managing COVID particularly well. Pretty much the opposite of what we have in Australia. So hopefully it won't turn out that way, but as I said, I think it is a good idea at this stage to err on the side of caution.
And we'll certainly get a clearer idea of that today or later today when the numbers come out. But we've now also learnt that WA health authorities waited more than 11 hours to inform the federal government and the other states of this positive case. Is there any excuse for that delay?
Look, there may be a number of reasons. They weren't quite sure about the case. They wanted to confirm it, etc. But I think at the end of the day, the sooner we notify the relevant authorities, the better. So I think that is very important. It has implications for border policies related to COVID. So I think we have to do things quickly. I even wonder now, anywhere in Australia, if a hotel quarantine worker actually gets COVID-like symptoms, even before the test result comes back, even though that tends to happen within 12 hours, whether we start treating him like a COVID case and already have his or her contacts down pat when the result comes back.
I think looking at how this case has played out, I don't think anyone would disagree with you there. But I think this is also why other states have reacted not too kindly, I guess, to how this has played out, because in those 11 hours, people were allowed to get on planes. Other states are now scrambling to track down those passengers. How much damage could that have possibly done?
Oh, look, I mean, it could potentially generate other cases that could spread to other regions. So I think that is why we have to try and do everything really well and really quickly with COVID. And look, overall, Western Australia and the rest of Australia has done a good job. Of course, there have been some slip-ups, some misses, and we have to learn from those mistakes and move on.
I do want to talk to you about, this is great news this morning, this COVID-19 home testing kit. It's developed by a Brisbane company, Illume Health. It's just sold into the US. It's a deal worth $300 million. It's a big news because the test offers a result. You can buy it over the counter at a chemist. It offers a result, a COVID test result in 15 minutes. This is a game changer, isn't it?
Oh, look, I think it's wonderful. And of course, it's wonderful that it's an Australian product. I think we're all very proud of that. And the company says that it's more than 95% sensitive. So it picks up about 95% of cases accurately, which is really good. And being over the counter, point of care, getting a result within 15 minutes, it is a game changer. It could change how we do things in hotel quarantine. It might allow more frequent screening and cheaper screening of hotel quarantine staff, so we can pick up infections early before they spill into the community. So there are a lot of potential advantages.
Do you think it should be available here? And for that to happen, we'd need to change our laws, because at the moment it's illegal to sell at-home COVID-19 tests in Australia.
Yeah, look, the reason that happened was the early COVID-19 tests, a lot of them looking at antibodies, weren't regarded as reliable. So if our regulatory authority reviews the literature on this and the testing on this particular test and finds it appropriate, then they will give approval.
All right, Doctor, always good to talk to you. Thanks for joining us this morning.